First, though, to the news on child vaccinations. Pfizer-BioNTech says their vaccine is 100% effective when used in kids between 12 and 15. Health Canada says it hasn't yet received the data from the study.
So it's likely that Pfizer, if all the data is fine, may be the first one where we'll be able to administer those to children at a younger age. But as we said, with any of these changes in terms of how the vaccines are used, the companies have to come into Health Canada, give us the data, we review it to make sure that the vaccines are safe and effective and of high quality, and that the benefits outweigh the risks in whatever population that it's studied in.
Fabien Paquette is Pfizer Canada's vaccine lead. Hi, Mr. Paquette. Good to meet you, and thank you for making time for our program this evening.
Thank you, Vashi. Nice to be here.
I want to start with the new data on kids aged 12 to 15, and I'm wondering in particular when you plan to submit that data to Health Canada in this country.
Yeah, these are actually very interesting data, and we are excited about the outcomes from that U.S. study. And the plan is that in the upcoming weeks, we will actually look into this and definitely make a submission to Health Canada. So no clear timelines. We have to look into the regulatory review process for this, but we're in constant communication with Health Canada, so they are aware, and we will submit as quickly as we can.
How long do you anticipate the regulatory process will be in the United States?
Well, that is a good question that is difficult for us to answer based on the information that the US may require. So it could take a couple of days, a couple of weeks, but it should be pretty quickly considering the importance of this data and what it means for the immunization programs in the US and in Canada.
Tell me from your perspective how significant it is and what it would mean for the immunization program, for example, even in this country.
Yeah, well, we always try to expand the opportunity to immunize and vaccinate as many Canadians as possible. So with these new data that are showing, very interesting safety and efficacy data towards an important population, this is actually helping to immunize further Canadians. And for Pfizer, and I believe for public health agencies across the country, it is a key outcomes as you want to ensure that you actually cover as many Canadians as possible and protect them against COVID-19.
The data has yet to be peer reviewed. I think it was 2,200 younger teens that took part in the trial. How reliable, from your perspective, is it to extrapolate that data more widely? And what might, what caveats might you attach to the data as it was presented today?
Yeah, those are preliminary data, and that's a good point to highlight to the audience here. I mean, this is, data that are coming out basically a couple of weeks following the second dose, but there will be further investigation that will continue moving forward. Actually, we believe that in the summertime, we should have the full reports about this. So those are very promising data that will be, clearly analyzed by Health Canada, and more details and the, I would say, complete information and studies results will be made available later on, and hopefully by the summertime we will have a full picture of the outcomes.
Does that mean that is it still safe, I guess? Let's say it does receive regulatory approval. I mean, I would assume with that approval it's safe to use, but just in case that full set of data is not yet provided, is it still okay? From your perspective, do you think the vaccine is still okay to use prior to that?
Well, definitely that will be a decision that Health Canada is going to have to make, but we're going to submit the information as they're coming in. And right now, we have information and data following about a month of data following the second dose. And we believe that with this and the additional data that will come out afterwards, there will be opportunities for Health Canada to review, which is why it's taking a couple of weeks for Health Canada to take a look at the information and the data that are being submitted and to take the appropriate decision accordingly. But of course, this is promising, and we believe that that's going to help to immunize more Canadians.
I think a lot of parents and grandparents are watching right now, happy to hear this news, but also interested to find out if younger kids will at some point be able to receive the vaccine. I know that Pfizer has just started those studies. Can you tell us more about that?
Yeah, actually, there is several additional studies being put in place right now. It's, of course, early stage, but clearly there is clinical trials in place for the 5 to 11 age group, and also even below that. So there's a protocol in place for the 6 months to 5 years old that is also going to be conducted. So these data will be extremely useful, and we believe that that's going to be helpful to, again, ensure that more Canadians will be immunized moving forward.
Is there any timeline for those trials to give us a bit of perspective on a few more months, for example, 6 more months, that kind of thing?
Oh, this is actually too early to say. Okay. We're just starting the clinical trial process, so it's going to take a few months before we actually get the enrollment in place and get everything ready. And of course, the analysis of the data will take additional months as well.
Okay, understood. I wanted to ask you some questions more broadly on the vaccine as well. You'll be familiar here in Canada that because of supply issues, the dosage, the delay between doses has been extended in most provinces to about 4 months. I know that's not necessarily what Pfizer had recommended initially, but it's been recommended from the Advisory Immunization Committee here. However, there is some new data that shows that might be problematic for people who are immunocompromised or especially the elderly. From your perspective, should Pfizer doses not be delayed by 4 months for those groups of people?
Well, actually, the position of Pfizer has been very clear up front, which is that according to the science, according to the data that we have, we believe that the ideal interval is 21 days. And that's what the science has told us so far. And we remain very clear about that position. Having said that, we understand that provinces might have to make decisions based on other criteria that are particularly important for their population. And that's why they have the opportunity to make the decisions that they're looking for. Hopefully now that we have additional doses coming in earlier in the first half of the year, we believe that should help to look into this with maybe a different perspective. And we also need to keep in mind that NACI's recommendation is saying up to 4 months. Mm-hmm. So this is giving provinces some opportunities to relook at their programs and maybe make different decisions, especially now that there is a higher level of reliability on the supply of vaccines in Canada.
I want to conclude just by asking you about that supply, because you're right. Yesterday, the federal government announced that Pfizer was essentially delivering 5 million vaccines in June versus later in the summer. Do you think there's a possibility that deliveries could be ramped up even further?
Well, it's always something that we look for. As an organization, we try to always improve and accelerate the deployment of doses in Canada. So we're really happy that we were able to bring 5 million more doses in June rather than the second half of the year. Actually, if you look into this is over 11 million doses that were supposed to be delivered in the second half of 2021 that have been brought up earlier in the first half of the year. And we continue to work very diligently with our partners at Health Canada and, of course, public health agencies across the country, but also internally to try to add additional doses for Canada.
So there is the possibility that even more could come sooner? Is that fair to say?
It is a possibility. It's part of the work that we're trying to do to bring more doses and actually accelerate the pace of immunizations for Canadians.
Okay, Mr. Paquette, I'll leave it there. Thank you very much for your time this evening. Appreciate it.
Thank you, Vashi. Bye-bye.
Hi, I'm Vashi Capellos, host of Power in Politics. See more of our show by subscribing to the CBC News channel or click the link for another video.